everyone. It's a dose of Dr.
Ooh,
Drew.
echo. Woo.
Really? That's how you're going to start? Okay. He's here. You're on.
Hey, everybody. Any echo on your end? I got a bunch of echo here. Piling in, everyone. Let's see what we got. Come on in. Come on in. Any questions? This is the chance we can get to it. Thank you, guys. Hi, Jessica. No echo. Excellent. 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 How is my health? It's good. Thank you, World Zen. This is your chance to ask some questions. We'll get right into it with you guys. What's on your mind? Did I really have to lose my job? That's really the question, Amanda. That is really the question, right? That's the stuff I've been worrying about from the beginning. From the beginning. Okay, I'm trying to catch up with you. How many have it? How many people have coronavirus? Right now it's about 8,300 at one website, which is, we're going up by about 1,000 cases a day, which is still doing very, very well. Are the ICUs going to be overrun? Well, that's what this is all about, is to prevent that from happening. That's what all these efforts are for, is to prevent surges like they had in Italy from overcoming the intensive care beds and the hospital beds. When is the panic going to end? That's what people are worrying about now. And I don't think there'll be martial law. Sorry, come on now. I don't think so. But people are getting panicky enough that there could be some unpleasantness out there. Who knows? So when will it end? We're really going to know more where we are by early next week and by late this week. So, we should be up in the tens and tens of thousands of cases by now. So because we are not, it seems like the next move is everyone's worrying about people who are asymptomatic carriers. And most of the testing is coming back negative. So it's hard to make a huge case for a lot of asymptomatic carriers, but we don't know because we're not doing universal testing. So that's where people are getting nervous now. But if there have been a lot of asymptomatic carriers running around, they should start to have an effect next week. They should start to cause illness by next week, it seems to me. Younger diabetics at high risk? You're at higher risk as a diabetic for sure. Talk to your doctor about whether or not you're in a specific risk category, because you may have tightly controlled blood sugar. You're saying 93% are coming back negative. Good. That's as long as more than 50% of the tests are coming back negative, we're doing pretty well. So the concern today is that there are people running around who are asymptomatic, infecting other people, particularly millennials. I know there's a lot of spring break concerns. If you are somebody who's been out and about, you might want to be careful particularly around older people. You should be careful around older people for the next couple of weeks. This is interesting. Mark is dating a nurse who's treating two potential patients. Provided she is doing proper isolation care, should be okay. Emergency rooms, urgent care. Let's see what you're saying here. Does the virus really stay in the air? It does stay in the air for a few hours. The question is it still contagious over those few hours? And it doesn't seem like people are getting the virus that way. It really is a much more close kind of a contact required for transmission. 475 deaths in Italy because they were overrun, which we are going to prevent from happening here, right? We are ahead of the game here. We are taking aggressive actions, and we are preparing our hospitals. Could it happen? Could there be surges occasionally in some places? Yeah, absolutely. There could be. But is there going to be a large-scale surge? I just don't see it. The big cities have got to worry about this. Places like New York City have got to take things very, very seriously. But I just don't see it. I just don't see where the numbers are suggesting we're on our way to that. It's very different than what happened in Italy. Italy, they had one case and hundreds came immediately following within a week. And they were overrun immediately. This is slow and steady so far. And somebody asked about herd immunity. That's one of the interesting questions about the asymptomatic carriers. If we have a lot of those running around, that will add to herd immunity. So when this thing comes back in the fall, it shouldn't be so intense. Is the mortality rate increased because the numbers aren't as high as influenza? we probably have better data in influenza, and we'll see where the fatality rate ends up. But it's clearly worse than influenza if you were over 65, particularly over 70. I don't know if you saw the data yesterday of they gave the breakdown of the characteristics of the people that had died as of yesterday. And there were a lot of 80 and 90-year-olds and otherwise 60 and 70-year-olds, a few 50-year-olds, but it was people 70, 80, and 90 primarily. And that is who is at risk here. I mean, by primarily, I mean almost all. The economics effects of the hysteria have been what I've been concerned about, not the economics so much, but is the real effect on people who are going to be losing their jobs. And how are we going to do this? And, just getting food now is getting to be interesting and challenging for people. I went to my office this morning. I saw people lined up at 7:30 in the morning in front of a grocery store. Again, not necessary. We should be able to do this in a way without panicking and emptying the shelves. Is nasal congestion a symptom? Can be, but don't worry about that. It's really, again, it's fever, cough, aches. That's the main symptoms. What can we expect if the herd immunity doesn't work? I've heard various sources it may not work because the virus is mutating. Don't listen to that. The question is, do we have herd immunity or don't we? And we may not. There may not be enough spread of the virus to give us any kind of herd immunity. Even the flu has elderly fatality. Correct. Again, 18,000 dead from the flu. You're still, as you sit here at this moment, you're more likely to die of the flu. But again, we don't know where this thing is going. So it's not fair to compare epidemics, but you can compare your reaction to epidemics. How did you react to H1N1, which infected 1 billion people and killed over 500,000? Did we have to shut everything down for that one? This one's worse. This one seems to be worse. Why is Italy being hit so hard? People are having various theories about it, including that they had no precautions beforehand. They were unprepared in terms of the need for intensive care and hospital beds, and they flexed. I've been involved with several meetings with doctors from Italy who are very optimistic about how things are going. Not so good in certain, like Turin, apparently they're having real problems there. But for the most part, Italy is in trouble. I'm actually a little more worried about France. I'm not hearing exactly what's going on there, but those numbers look really problematic. And it's appropriate for them to shut everything down. It's not appropriate for newspapers to be wondering why this country doesn't shut completely down. We don't shut down completely because there's no reason to. We are not in that shape. Is this worse than H1N1? It depends how you look at it. If you're 40 to 60, H1N1 was definitely worse. Definitely worse. H1N1 killed 40 to 60-year-olds. If you were 70 to 90, this one is substantially worse. Again, some of the fatality rates I saw in Italy was that if you were over 70, the fatality rate was 8.5%. So that's far different than everything else. Mom is 70 and diabetic, has cataract surgery. No, your mom should postpone the cataract surgery until we get through all this. The whole don't take ibuprofen thing seems to have gotten out of hand today. I know that there's been some question about the ibuprofen issue and some of the outcomes. All things being equal, take Tylenol until we sort this out. I don't think it's going to be that big a deal, but why not take Tylenol in the meantime while the science gets worked out? The same thing is true of ACE inhibitors and ARBs, whether they are going to have a significant effect one way or the other on the infection. And actually, as some data suggest, it may behoove somebody to be in an ARB and reduce the risk of the virus getting inside the lung cells. Again, this is science that has yet to be worked out. Why are you saying Tylenol is very bad, Chris? What are you saying about that? Okay, Gus, you're tracking the dashboard at Johns Hopkins, and I see we have not spiked. We have not spiked. We have continued to grow steadily, which we would anticipate. We were expecting a spike. Like I thought by the end of this week we could be at 50 to 100,000 pretty easily just by virtue of testing. That has not happened. If anything, we seem to have kind of slowed a little bit over the last couple of days, which is rather confusing, which is why people are saying that they're worried that the asymptomatic carriers are now going to have an impact and spread this thing more widely. And that's when we'll see the sudden tick up. Does not appear we are seeing it now. Let me look at the Johns Hopkins site as we speak. The website tells us this is the Johns Hopkins Coronavirus Resource Center. According to this resource, it's 7,769 cases. We were at about 6,700 last night, 118 deaths. So we're up by about 3 deaths from last night and about 1,000 cases, which that's a decent pace. That is not something people should be frightened about. But again, we don't know how many tests are percolating and waiting. In other words, maybe there's 20,000 cases waiting, 20,000 tests out there that are being tested that we don't know the results of yet. Yeah, a lot of people are getting turned away who have all the symptoms because they don't have lower respiratory infection, instability, or evidence of exposure. That seems to be the necessary combination of phenomena to be able to test it, to be able to get testing or meet criteria for testing. And again, that's the concern, that there may be people running around who aren't being tested that could be infecting other people. And that's why self-quarantine and social isolation has become such a key piece of all this. Tennessee governors predicted 6 months for this to run its course. That seems long to me, particularly given how we are percolating along. We're kind of percolating along. Germany's cases are high, but their death rate remains low. Right, because they are prepared. They are not as old as Italy. And when it hits young people, it doesn't cause fatalities. So that's the Germany story. And they're also prepared for this. I'm looking at more of your questions. Does someone who have MS more at risk? I'm not sure that multiple sclerosis adds to the risk so much as the treatment of the multiple sclerosis. So that's why you have to really check in with your neurologist about whether or not you should be considered yourself a significant risk factor. Now, I'm reading from the New York Post. There are these really doomsday reports coming out of this British organization. I'm blanking right now. The Imperial. I'm forgetting the name of the institution. But they are saying 750,000 downstate New Yorkers could crush into the region's healthcare system. 750,000. Okay. So that is speculating in this scenario, is speculating that just that region is going to go up 100 times from where we are as a country, right? As it is, we're going up about 1,000 cases a day as a country. Just think about these doomsday scenarios and how big these numbers are and how far we have to go to get into that many cases. It just, so far, we are staying, the slope is not accelerating. It doesn't seem to be, at least. 62 in cancer survivor, you should self-isolate for sure. Why are Hollywood stars getting more than the average person? Yes, you should ask yourself why the NBA players all got tested. Why was that a group that got preferential treatment? I'm hearing people selling tests to people at sort of gouging prices. Why does New York City get the hospital ship, but LA doesn't? Because of these doomsday scenarios that are out there in New York City, and the Post are, people are people are getting their data from that. And again, I just don't know how the country goes. If New York goes from, what are they at, 1,000 or something to 750,000? I mean, the massive rate of increase that Dr. Burke said today, there were signs in people in Europe have a higher death rate than expected. She didn't clarify if the younger people had any underlying problems. Right. Yes, the data keeps coming in fits and starts, right? And occasionally you'll hear a bunch of data coming in where a little more trouble is being had by young people than expected. We don't know if that's going to wash out when all the data comes in or not yet. So, let's see what we got here. Yeah, asthma is something that people ask about all day, every day. And asthmatics have not been specifically told that they are at risk. And yet, if you're a bad asthmatic, I think you have limited pulmonary reserve. Smokers are at risk. Limited pulmonary reserve. And by the way, some of the data on young people did suggest that they were smokers. So asthmatics, in my mind, should be careful because they don't have as much to call upon should they get sick. And Barbara, you say your reactive airway disease. It depends what that reactive airway disease is. Is it have COPD? Is it post-bronchitic? Do you have adequate pulmonary reserve? That's the question. Rural areas in danger of the virus to get bigger than cities. Really, the rural areas are my concern. The rural areas more that their little hospitals could get overwhelmed if there is a surge there. That's sort of more the issue there. How long is this going to be? That's the big question. I wish Dr. Fauci would talk a little bit about some of the models he is using for next week. In other words, what would he anticipate a good number by the end of next week? Is 50,000 good by the end of next week? That to me seems like it would be pretty good if we've identified 50,000 people and isolated them. Discrediting reporting. I'm not discrediting reporting. I'm discrediting the language that people use to panic people. For instance, the whole term shelter in place. Why are we using shelter in place? Why aren't we using quarantine, which throughout human history is what we use? Shelter in place was a term reserved for active shooters. Shelter in place implies barricade yourself in a room. Why are we using that language? That is unnecessarily getting people deeply upset. That's what I'm concerned with. The language and the continued pushing of worst case scenarios. That's what I'm taking issue with. That's it. I'm not taking issue with the data. I'm not taking issue with what Dr. Fauci says or tells us to do. I've said from the beginning, let him be your North Star. Do what he tells you, and we will get through this fine. Yeah, Dawn is talking about how she wasn't screened properly after she got back from Europe. And I'm hearing that our screening at the airports is not quite what it should be. No, I don't think it's PC language, Charlie. I think it's attempt to capture your eyes. And that's not fair to the public. In a situation where they're already anxious enough, things should be told to them in a very, just the way Fauci does it, just a dispassionate way. Just tell it, listen to the doctors, listen to what Dr. Burke says, and that's it. And that's it. You do what they tell you. Wait, what did you say the governor from Ohio is saying? Hold on here. Right. That's an interesting observation that they leveled off at 85,000 cases in China, even when things were out of control, and yet they're predicting 750,000 cases in the state of New York alone. I mean, think about those models. There's something about those models that are not working. Think about it. China out of control, they leveled off at 85,000. New York in control at whatever they are, a couple thousand, and now they're expecting 700 times that. I don't know. Yeah, why is Trump speaking in a room with more than 10 people? That's a great point. I don't like that either. But I would say the same thing of the press that file into this press pool there too. They should have limited people in there. Somebody said something about the Ohio governor. Want to tell me that again? I can't find you. Again, I'm sorry. I'm losing you. Thank you for saying that Teen Mom is on this week. That's hysterical. Okay, I'm sorry. I'm scrolling up to see that somebody said something about the Ohio governor. I wonder what they're saying. Yeah, I actually appreciated Mayor Garcetti here in Los Angeles was first saying shelter in place, and I made an issue of that on television last night, and he changed his rhetoric. He said, we will not use that language. That's too harsh. And I thought, God bless you, Mayor Garcetti. That is somebody who, adjust course, we're fine. So I have no problem with what Mayor Garcetti is trying to do right now. And he's trying to navigate a sane course, and I appreciate that. I think we have gone too far, but it will have the beneficial effects we're all looking for. So I don't see how these models play out with us not being around each other. I went to emergency room last night for a dislocated finger. I'm at risk, which is exactly why people should not go to emergency room right now. You should be doing telemedicine. You should be going to urgent care at most. ERs right now are the most, I don't want to say anything too inflammatory, but ERs is where you can get exposed, right? That's where you can expose other people and you can get exposed. So you want to limit your going into emergency rooms to an absolute minimum. There has to be a good reason for it. Whoever said Tylenol was bad did not tell me why they were saying so. And whoever said something about the Ohio governor did not tell me. I cannot find it, so I don't know what you were thinking about. Do I think South Korea has adopted best model so far? Yeah. It has drawbacks, sure, but they seem to have gotten things under control very quickly and looks like a decent model. Let me look at their data right now where they are at the Hopkins Reese. They're at 8,400 cases. Yeah. Yeah, they're doing great. And they have 84 deaths. So they're better than we are. Of course, they're not as widespread as not as many people, but they clearly have gotten this under control. France seems to be leveling off a little bit too, which is really good to see because yesterday they were spiraling, but we'll see if that holds. And then Italy is in trouble. Italy has now 35,000 cases with 2,100 fatalities. That is a lot. And that got away from them. And yeah, that could have happened here if we didn't pay attention, which we did. Again, pay attention to the CDC. Let them do their job. Don't listen to the press. Listen to the CDC and do what he tells you, and that's that. Chloroquine is an effective treatment. Yeah, chloroquine and hydroxychloroquine have been shown to have some benefit, as well as some zinc. They were using zinc with that at one point. To the extent to which we can expect good outcomes is going to be dependent on peer-reviewed data that's coming in slowly. Somebody said they're worried for addicts. Addicts are, how governor said it's coming to get us. Yeah, that's great rhetoric. My goodness.
Hey, Drew.
Yeah.
Adam Carolla said he'd be on Ask Dr. Drew on Sunday.
Oh, good. Adam Carolla is coming in here on Sunday to answer your questions and be part of the conversation. Interesting. That'll be fun. So be here for that. We appreciate it. Let's see. Yeah, so you're asking about stopping seeing patients face to face, what some places are doing, and that you're allowed to be around 10 people. I mean, this again, as long as you practice social distancing and nobody has illness or active exposure, that is following the CDC directives, right? They haven't said lockdown. Well, Italy. Somebody wants me to talk a little more about Italy. Italy actually flexed. They turned all their surgery units, their surgical suites, and surgery centers into ICU beds. They took all those anesthesia carts and used those ventilators for their patients, and actually made a big difference in handling some of the people that needed more care. I haven't had an update today. I don't know if the surge has continued, which is why things are overrun, say in places like Turin. But it'd be interesting to see. Cowboy says this is a really good comment. I want to get it. Where are you? Where'd it go? Ohio governor said 20 times more deadly than the flu. Yeah, if you're 80, it would be. That would be an accurate statement for certain age groups, not for everybody. Oh man, somebody said with cowboy in their tag said, I think Dr. Fauci is overreacting. I don't know. I said that. I said he may be overdoing it, but you listen to what he says and let him do it. He will guarantee success, and you listen to him. Somebody with cowboy in their name was saying that he turned off television as only watching the CDC website. Good. That'll keep you safe. Perfect. Well done. And keep you also from getting into the panic. I mean, panics like this, they can go bad, everybody. I mean, this can get, not only are people, we're just starting with the job losses too. So people's lives are being upended. You don't know where this is going to go. And that's the part that I've been yelling about for a month. That's the part that has frightened me. And if indeed the virus is under control, which is great, then the panic is going to be worse than the virus. So how long to get test results? About 2 to 4 days. Although there's a rapid test out there that's still available on a research basis, and we don't know if it's going to be yet available widespread. No, it's not about money. It's about you being able to support yourself and feed your family. That's what's at issue here. People are losing their jobs that are going to be in real trouble. Thankfully, the government is stepping up, it looks like, and helping these people. And that's one of the reasons I was happy yesterday to see the government act in concert properly to help people out in a crisis. But man, it's going to be, if it doesn't end soon, if the complete kind of lockdown keeps going, it's going to hurt people. And that's the part that I am concerned about. And then today I've been noticing that people are out of their minds frightened. And the reason people are primarily scared is that they're being told, they're being told that there are these people out there who are asymptomatic carriers and you need to be afraid of them. They're infecting you. So that made people really spin out today because that's the main concern. We are not seeing the surge that we thought we would, right? But we do believe that there are plenty of asymptomatic people out there. And the question is, how many of them have exposed other people? And that will be showing up in the data in the next week. So we should see a surge this week by virtue of more widespread testing. It's been pretty steady with no surge. Again, as I'm reporting on it now, it's 7,769 cases. That's up. Again, we're going up about 1,000 a day. That is not accelerated. You're not seeing the accelerated where exponential would be, depending on the slope, could be 1,000 today, 10,000 tomorrow, 100,000, the next day. It could go up very, very quickly. We're not seeing that kind of growth. We're seeing slow, steady, which is kind of an indication of perhaps something like flattening, depending on where we are, which we don't know yet. We won't know that till next week. So it's, let's look at the China data here. If it won't show me it won't show me the slope on things. Yeah, this New York Post article is disturbing. 750,000 cases in New York. That just doesn't. I don't see how we get to that number. I just don't see it. All right, let me look back at your questions here. Somebody said a type A blood type may be a vulnerable subset. I don't know that that's true. Again, there's lots of rumors flying around and not a lot of good science just yet. Anna Marie says I panic and then I calm down. I do the same thing. I go from thinking we're going to be fine. I'm looking at the numbers. It all makes sense to me that we're going to be okay. And then I read these doomsday scenarios and I think, am I missing something? Is there something in here that I'm not getting? And why am I? Then I get angry. Then I start doubting my judgment because they don't make sense. These things don't make sense. How could this be for 43-year-old pre-diabetic? As long as you're managing your sugar, it should be good. Is there a criteria for the government looking for in order to let us go back to normal? That's what I would like to know. Yeah, Brian asking the question, what's the criteria the government is going to use to let us go back to normal, or at least ease our way back? And that is a great question. And I wish Dr. Fauci would talk about that, because that would help us all understand kind of where we're going. And I suspect he might begin talking about that next week, because then, as he said, the next 2 weeks will tell. And I think he's looking at what I'm looking at, that things are looking okay today, but that doesn't mean tomorrow it couldn't suddenly pop up and get away from us. Let's see here. Okay, yeah, I'm wondering, I'm hearing there are blood shortages right now because they've shut down a lot of the blood donation centers. And so I'm wondering, I've not seen any direction on that. It makes me want to go out and give blood. Will grocery stores shut down eventually? Everything says the food supply chain is fine. But if this goes on for a long time like this, I don't know. That's the stuff that I am worrying about.
They're hiring more people in the grocery stores.
They're hiring more people?
Oh, yeah.
Interesting. I understand they were given masks, too, the people at least at the conveyor belt at the checkout. People are asking me to comment about the end of the Kevin and Bean radio show, the Kevin show today. And radio is a tough business. The way radio works is they call you in, they say, I'm sorry, today's the last day, and then they escort you out. That's how radio works. I loved Kevin and Bean for 30 years. I have nothing but great things to say about Allie and Kevin and Bean and everybody that was on the show. And Jensen, these guys are really serious talents, and they did a great show. I don't know why it suddenly ended. That's kind of the way radio is, and it's sad that it's that way, but that's how it works. And it was a privilege to work with those guys for as long as I had the opportunity to do so.
Very sad.
Yeah, it's sad.
Would you shout out to Blue Microphones?
Oh, yeah. I want to thank Blue Microphone, who's been so instrumental in helping us get this thing, get the sound we're getting, and the microphones here and these headsets. They have been in the business for 25 years or more. They are the choice for YouTubers, podcasters, musicians. They have a setup that make you look or sound great. I mean, listen, the quality of what we're able to do here has improved dramatically. You can visit bluemic.com, BLUEMIC, bluemic.com. Get started telling your story. Again, they've been helping for 25 years. The products are amazing. I've got some cool in-ear stuff coming soon too. Can people be tested to see if they've already had this? There are things like that. There's a rapid test out there that might become available that would test the antibodies. It is not available at this time. It's still only available on a research basis. I wonder about that as well and whether we need that data. I think right now we're focusing on containment so completely that taking your eye off that ball was not going to help this. All resources, all hands on deck go to maintenance and preparation. Containment and preparation. My husband's concerned about going to work and bringing it home. Yes, that is a concern. A doctor in Mexico says it could cause severe pneumonia in a 40-year-old. Yes, it can. This is the point. It can cause illness in children. It can cause illness in young adults. But in this country, if you look at the 115 that have succumbed to this illness, the vast, vast, vast majority were over the age of 70. So just playing the data, let's just look at the data. Okay, so you have 70, let me get the up to the minute data. I think it's 7,700 cases. Yeah, 7,769 cases in a country of 250 million. Okay, 7,700, 250 million, 115 death. The probability of you, the 250 million, being one of those 115 that die, you got to be over 70, and you've got to be in contact with somebody who has this. Now, that's where the mystery comes into where we are in the curve today. We don't know how many carriers there are out there. We don't know how many people with mild illness are out there secreting virus and exposing other people. My bet, given that such a high percentage of the viral testing that is being done on a regular basis now is coming back negative, my bet that the main intervention we have taken to reduce this thing is shutting down Europe and China. That, I think, was our main move, and it's going to prove to be the most significant thing in getting this thing under control. Okay, maybe we're at 320 million. We're over 300 million. Okay, so 7,700 cases in 300 million.
So
we have 24 million flu cases. You're more likely to be a flu case. Again, different issue. I'm not comparing epidemics, but just think about it that way. Yes? What's that?
Remember you mentioned the age group and that at a certain age we don't use ventilators for elderly?
Yeah, I don't want to say that publicly because people are not understanding what I mean by that. But just that when I first got tested, I'll look at the population in China. Chris, I am. That's billions of people. And then billions of people were prevented from getting this illness. They did not get this illness. Youngest person on record to have passed of this, was 45. I'm not sure that's true. I'd heard about some 30-year-olds that had died of this condition. Got an eye exam today. Now I feel contaminated. I doubt the person who did your eye exam has this virus, unless they are just coming back from France, Italy, or Spain, or have exposure to someone who did. It's very unlikely. But if you want to self-quarantine yourself for a couple of weeks while you wait it out, that certainly seems reasonable. Okay, I'm running out of steam, everybody. How are we doing here? How long have we been at this?
34 minutes.
How long?
34.
34. I usually don't run out of steam that quickly. So let me see if I can go another 10 minutes or so.
That's a lot of information.
Yeah. Let's see. Cardiologist said the random slowing of electrical process in my heart would not make me high risk. I agree that. You don't have cardiovascular disease. You have electrical disorder of the heart, which is not cardiovascular disease. So you don't have that. Oh, goodness. 20-year-old died, but he had leukemia. That's true. I did hear about that. A 21-year-old died of this virus who also had leukemia. Chris, come on now. Stress. Yeah, I don't know what you mean by bedside manner for the media. I'm just taking issue with the language, that the language is all words like staggering and shelter in place and things that the choice of words that do not need to be used to make things worse are intended to make things worse, so you watch them. And that, I think, is a reprehensible impulse. Reprehensible. It should be, hey, everybody, get your flu shot, listen to Dr. Fauci, let's get through this thing. So, okay.
Let up with toilet paper.
Yeah, I'm not even sure that's necessary. Thank you, guys. Anne says it is staggering. Is it staggering? We have 24 million flu cases and 7,000 corona cases. 7,000 is staggering. If we get to 750,000 in New York, like this New York Post article suggests we will, that is staggering. That is staggering. I'm with you on that. 750,000 in New York would be a staggering number because a large percentage of those would be really ill. And that's the problem with this thing. Here's Bruce Heischober. Let's see what's going on in the, Bruce Heischober, Dr. Spaz is asking, what do I think about the contention the virus is transmitted airborne? There is data that the virus will persist in the air. Now, that's been proven now, but it has not been shown that that is a means of transmission. So we'll see. I'm going to bet that is. I mean, it makes sense that it might be, but it doesn't seem like the surfaces don't seem like the main region whereby it's transmitted. It seems like it's close contact. Let's see. Somebody's posting. Kevin Ryder says he and Kevin and the morning show personalities were fired so that the ratings were down. Sad to see them fired. Yes, I did mention that, and that is the radio business, man. It is brutal the way it's handled. People are just. I had a show at KABC, which I enjoyed doing. One day we were called in the office and we were said that today's your last day, and that was it. Is Dr. Fauci recommending shutdowns and shelter in place? Not that I have heard, not as of yet. And when he does, then that's what we will do. Is airborne really the strain from China? I don't know what you're asking there. Flu shot will only help with the flu. That's right. But there are 24 million flu cases and 18,000 deaths. And right now, there are 7,000 of this thing. We don't know where it's going, but you should be protecting yourself from the other 24 million cases of flu that have come down the pike this year. Can people get this numerous times? So this is a question that comes up all the time because people keep hearing stories of recurrences. And what seems to be the case, again, this is all, the data changes all the time, is that the people that tend to keep secreting virus, there's some people that recover and keep secreting after that 2-week window that most people resolve. And those people come back with another case. They recur. So it's as though the virus is still active in their system. They keep producing the virus and then they get ill again. So that's the group that needs to be watched carefully. Jessica, I don't want the flu or the coronavirus either. I am with you on that. Oh, also, Dave, the King of Mexico, too, he lost his job, and I'm sorry for that. He was an excellent producer. Do I think Governor Newsom moving the homeless off the streets and into hotels will help? Absolutely, except that is not happening. That is not happening. I spoke to the head of the LA County, the LA Union Rescue Mission last night. And Dr. Reverend Bale said he sees no evidence of anybody moving off the streets, but he's beginning to get respiratory illnesses that were apparently flus, but maybe coronavirus coming in his doors now. So we're on the verge of real trouble downtown if we don't move these people into something. Sprung tents, FEMA tents, motels fine, but you have to provide services for these people at the same time. And thinking that they will go, they're not going. They're not going. Even though they're afraid, they are not going. Fear might motivate them, but you're going to have to do a little more than fear, and you have to provide those environments right away, because if this thing breaks out in our homeless population, that is 60,000 people that are seriously at risk. I don't understand why no one's talking about that. I mean, giving a few trailers and some hotel rooms in Northern California is not helping us down here. I tell you why we do it, what you can do, Governor Newsom, is declare a disaster. Please, Governor Newsom, you've declared it under emergency. Declare a disaster so we can push aside all the regulatory red tape that prevents us from helping the homeless. Please, that's what it's going to take. In the meantime, these moves are good. I'm glad you're doing it, but it's not going to work. Not going to work. Yeah, hopefully we'll begin. Somebody's saying we should be washing our hands anyway. And yes, hopefully we'll do that next flu season when we think about this year and how extraordinary it was. All right. Do we need to disinfect things we buy from the grocery store? You need to wash your hands after you bring things home from the grocery store, because after you handle anything, you need to wash your hands, frankly. But this is not a foodborne or waterborne illness. If it were, we would have a very different set of problems on our hands. How do I think Canada is doing? I think Canada just locked their border, so something is going on there. I don't know. Update on existing medication. Yeah, there are multiple antivirals being tested and combinations of antivirals. Those publications are being peer reviewed and will be available probably going to be 2 weeks before we really have some good data we can look at, where we can make decisions about kinds of treatment that might work and do no harm. Again, supportive care at this point is really all that we're up to. Are we up to 9,000 cases, he's saying? Depends which, let's see which site we're looking at here. Yeah, we're at 8993 on this website. And on the Hopkins website, we are at, let's see what it is, 7769 still at Hopkins. My sense, and again, this is my gut on this, is if that we are in and around 20,000 by the end of the week, we are doing very, very well. If we are continuing to practice what we are managing here, and this, which appears to be efficacious to this point, if we are doing what we have been doing at the behest of the CDC, if we're around 20,000 at the end of this week, boy, that's starting to look good, it seems to me. Again, these are people that are identified and isolated and being taken care of. Then we will find out in the following week how much the so-called unidentified carriers or asymptomatic carriers could be adding to the problem. And that's going to be an interesting number. So, the end of next week could suddenly bump to 250,000. It could, easily, nationally, not just in one state or one locality. 20,000, super terrific. 20,000 is doing very, very well, really, in this entire country. Again, it compared to 24 million flu cases, compared to 1 billion H1N1. You've got to kind of get your numbers right. The dangerous number for us is 1% of the population. That's when things really get out of hand. And 20,000 is not 1% of the population. So we are doing pretty good at that point. And if the rate of change starts to really flatten next week, again, hard to say if it will or not, that's good. That's doing pretty good. All right, let's kind of wrap things up here. Susan, any other questions or anything?
No, I think you're doing a great job.
Okay. I think
you're working very hard at this to answer as many questions.
Yeah, I think it's looking kind of good. And again, I've been saying all week that 20,000 by the end of this week would be really pretty good. And if it's 20,000 by the end of next week, that will be extraordinary.
I feel so bad for everybody who's losing their jobs.
I know. That's the part that is going to be hard to heal, harder than healing from this infection. And how long that goes on before jobs are...
Hotels are closing.
Oh, like crazy. Hotels, restaurant. And how far that goes on before these things can't be reopened. Man, that is serious business. That is upending people's lives. And we want to try to mitigate that if we possibly can. Worldwide, there continues to be a pretty good, steady increase. We're at 214,000 worldwide. But again, keep in mind, H1N1 was 1 billion worldwide, 1 with a B, 1 billion. So we're nowhere near those kinds of numbers. All right, everybody, thank you for stopping by. And we try to do these on a regular basis and help kind of reduce anxiety, because that is what is in the air today. It's just complete and total panic.
Everybody.
And the panic is not helping.
It's a bad day today.
Is it? Do you think so?
Yeah, everybody's panicking, and our family and our guests and our people everybody's panicking. Yeah, it's pretty alarming.
It's sad. It's sad. And if it doesn't bear out, if we are panicking for no reason, I want you to remember this, that, all the casinos closed last night.
Oh my God.
Yeah, they did completely. And they'll if they can be closed for a couple of weeks and then get back going again, I mean, it'll be a much better situation. But
So what happens when we open up the gates again?
Well, I've been saying quite along that is the tougher putt. How we turn back on again without causing another outbreak, that is a tough putt. Because I don't know how to do that, and I assume the CDC has good models for that, and I wish they would begin telling us about it. Like what numbers? 20,000 is not too late. I got news for you. 20,000 is not too late. Once we reach numbers that start to plateau, how do they know where we're good? What are they looking for? What do their models tell them on the other side? And how do we get out of this in a way that we don't cause another outbreak? That's going to be very challenging, and that needs to be done in a timely manner and soon. It needs to be done as soon as possible. What is possible without doing it is the question. So thank you very much for stopping by, and happy, joy, Susan. That will do it. You have your risk statement.